So Rashid, tell us how the home care program services work. Is it on request by the patient? Can it be recommended by the doctor? How does it work?
So it can work in multiple ways.
Yeah.
So if you're not an Aga Khan patient and you want a home care service, let's say you want a physiotherapy service, you want a nursing care, 12 hours, 24 hours, then you can reach out to our home health call center, and then a nurse will come and do the assessment, and based on that assessment, the service will start. So that's one part. If you're a hospital patient, an Aga Khan patient, and you had a surgery very recently, then the doctor can recommend you, or you can even ask. In both cases, the nurse will come, the nurse navigator will come to your bedside. They will do the assessment, what kind of service you need, and for how long you need that, and then based on that, the service will start. So it can work both ways, being an AKU patient or not an AKU patient. It can be a self-request, and it can be a doctor recommendation as well. Okay. So if someone is an 80, 85-year-old, and the kids want their father or mother to be looked after, it's not a doctor's request, right? But they can reach out to the home health program, and then we can provide the nursing care for 12 hours or for 24 hours.
Okay, all right, that's interesting. So tell me, what sort of services will be available under the home care program?
Okay, so we have just started few of the services, but this, like any service, it will expand and grow.
Yeah.
So right now what we are doing, we are providing the nursing care for 12 hours as well as for 24 hours. There is a nutritionist support. There is a physiotherapy support. Then there can be doctor's visit, a family medicine practitioner's visit, or your primary doctor, whoever that primary doctor is. There can be home medication. It can be home lab as well, where the phlebotomist will come, draw the blood or take the sample and go back. And then you will get the results on your phone app as well.
Okay.
We have recently, as I mentioned, that we have an electronic health record system. There is a patient app as well, which you can download. It works on Android as well as iOS. You can download, and your lab results will be available on your phone.
All right, and you said that the cost compares very well to perhaps hospital care.
Correct.
Is it open to patients who are on health insurance, or is it strictly cash? How does that work?
So interestingly, we are working with our insurance companies. We had a session with the insurance companies, all top 40 insurance companies. We got together and we explained to them that it makes sense for the patient to do it at home for their comfort. So that's one part. And the second part is it makes sense for the insurance as well. So if a patient is staying at the hospital, occupying a bed for one night and paying, I'm just saying, 50,000 shillings for 1 day stay, which includes doctors, which includes lab, which includes
nursing
pharmacy,
care,
which includes nursing care.
Right.
But if that can be halved or less than half and be provided at home, is it not the right thing to do? So the insurance partners, and I think this will, if this understanding will evolve, that they will like to partner with us in providing home health services.
All right, and you mentioned that you can get round-the-clock care.
That is true.
In the home care program, just as you would if you were in the hospital,
correct.
Right? So these are services that would be available 24 hours a day?
That is correct. So it can be 12 hours and it can be 24 hours as well. Okay. So the nursing care, which will be available for 12 hours as well as for 24 hours. As I mentioned, the first time, nurse will assess the patient. What the needs are, and based on that, the nurse will make a recommendation. Now it is for the patient and their family to decide if they want for 12 hours or for 24 hours.
Yeah. This is now available in Nairobi?
It is just available in Nairobi. It has just been a month since we started this service.
Okay.
We will see how it is accepted in the Nairobi market, and if it is, then we'll very soon expand to other geographies in Kenya as well.
Okay. Any plans you think in the future? I mean, I know it's been a month, but to think of taking this outside the country?
Outside of country, that will be very, very difficult because there are legal laws.
Yes.
You need a license.
Right.
In Kenya, we are a licensed institution.
Yeah.
If you go out to, for example, Congo, then you have, that's a completely different business venture.
That's right.
So licensing and all other requirements are very different.
That's right. What sort of feedback are you getting so far?
So far, people are loving it.
Because you piloted it in 2022, now been running for a month. What are the patients telling you? What's their experience?
People are experiencing that they are happy to be away from home, away from hospital. So that's one part. Less chances of infections, all that.
Yeah.
The older population can stay with their grandkids and their kids. So that's one part. It's more humane treatment when you are doing it at home. So people are liking it. People are also appreciating that it's cost effective for them staying at home and getting the services at home rather than coming to the hospital and spending nights over here. So the feedback that we have gotten so far in the past 1-2 months, it has been very, very positive.
Okay, yeah, truly something worth being part of a trailblazer about. Yeah,
Yes.
yeah, absolutely. Thank you.